interesting case. We're going back to Amaryllis Farms there in Bridgehampton, New York, way out on the end of Long Island. Now, Christine DiStefano, who's the founder of Amaryllis Farms, this is a equine horse rescue. She's been in the horse business her whole life. She's a high-level barefoot farrier. She's a equine horse massage therapist through the Masterson Method program. She's an appraiser. She knows horses. She also rescues horses. That's her life's work right now. I went out there a year ago and I worked on Waverly. She texted me recently and said that Waverly now is not able to graze anymore. Too much tenderness and pain, bringing his head down to the ground. He's approximately, if I remember correctly, a 21-year-old Tennessee Walker. And I just want to highlight why that's important. Like, grazing is not just a hobby for a horse. Now, a horse might be living a different life now. They're on a farm, they get hay in their stall throughout the day. You can also give horses their feed at a waist level. You can put a trough out at waist level. But horses were meant to bring their heads down to the ground. And then functionality of bringing your head down to the ground is very important for their entire being. Now, horses are prey animals. They need to have a 360-degree rotation. If they can't move their head and see all the way around in 360 degrees, they're under a lot of stress and anxiety. If they can't graze and get their heads all the way down to the ground, that also is very stress-inducing for them. They get anxious and stressful. Now, besides a horse that gets to eat out of a hay in their stall, a horse, if it had the ability to graze 24 hours a day, which is their natural evolutionary state, they will graze up to 16 hours a day, consuming 1 to 2 pounds of food, which is equivalent to half a kilogram to 1 kilogram a day. Half to 1 kilogram per hour, or 1 to 2 pounds of grazing matter, dry matter per hour, which equates to 16 to 32 pounds a day, or 7 to 15 kilograms a day. That's a lot of weight, and they need that. And when they don't have that, when they don't have the ability to bring their head down to the ground, it causes great stress. Now, Christine knows her stuff. She asked me to come out, but she really believes it's the poll, which is that upper area. Now, the poll is so important to the entire horse. If a poll is misaligned, it'll also mess up all the way down the back and possibly into the rear end, and vice versa. If the rear end is messed up, it can mess up and reflect in a wave-like motion all the way to the poll. So I'm going out there, I'm going to see a few horses. I think I'm seeing a goat, but you'll get to see all that. But the main thing is, let's see if we can make a difference with Waverly.
Just as attached to Joey as he ever was, which is why he's here. But in order to gain access to Joey to work with him, we have had to give him a pet. That's his sister.
Oh,
that's
and they bond really well?
Pocahontas, and for some reason, they get along extremely well, where, as you knew from last time, he will accept no other horse. And Joey, he accepted Pokey, and she's like, well, you eat a lot, so I like to live with you.
Does he still love Joey?
And they're good. He loves Joey. Joey can't be out of his sight ever.
So if I remember, he's a Tennessee Walker.
He's a Tennessee Walker.
And he's about 21 or 22 now?
He's somewhere in that 20 to 25.
Yeah.
And
what was the story of you getting him?
Oh, he was slaughter yard. He was loading on the truck, and the kill buyer himself, who I was talking to back and forth on the phone, I said, you don't want this horse.
Yeah.
This one you don't want. Take somebody else. He's got what's called a sticky stifle in the back. So there's something really wrong with his stifles in the back. I'm not afraid of a stifle. I'm not afraid of navicular. I'm not afraid of a lot of the things that, because I can heal them. We can heal them. I know how to work around things and get you good and comfortable, because I don't believe in any pain. And so I said, let me give it a shot. And I brought him in, and he's fine. He's got, genetically a sticky stifle, they call it. It doesn't lock out on him. It's not a locking stifle.
Does he get quad problems?
It doesn't bother him. Nothing bothers him.
Is it on this back left?
If we have a lot of snow, you'll see the, hitch, when he walks. But if everything's going fine, you'd never notice, anything. And he's not ridden, so he's just played with and taken care of. He's a very nice, special boy. But when he moved into this field, now we've had him for a couple of years, Pocahontas is a mare, and so he's had to protect her from the little, hot rod pony that you just adjusted.
Right.
His heel is all that. And the young thoroughbred who came in, who's another Mr. Studley. So Waverly suddenly had to not just watch out for Joey, but do a lot of running back and forth and pull Pocahontas back from the flowers and chocolate
Sorry.
that she was being offered by these other suitors. And somewhere, I think, in doing that, he hurt his neck, he tweaked his neck.
And he was having trouble going down, right?
He could not get his head below
You don't have any little
my hand.
treats on you, do you?
I do. And he can move his head.
Let's see if he comes down. What I like to see sometimes is, here, let me, if he can bring it, here, let me get on this side. So, here, you stay over there. That's fine. Well, I guess no, you were right.
He's going to follow me.
Yeah, that's not going to make any sense. But we want him to bring it down towards his chest.
Yes, you see still where it's not that. He's not that comfortable up there
Yeah.
on his pole.
Okay. And does he want to go up high? I'm going to lift him up a little. Is that okay?
Waverly, you're okay.
Yeah, he's still kind of stuck there.
Yeah,
Here you go.
but he can make it, so this is good.
So there's this adjustment that we do when the neck doesn't want to come down. It's called a anterior atlas. The atlas is really big, and there's a little bump on the front called the anterior tubercle, and it can, hey buddy, and it can tilt down or it can tilt back. And when it tilts back and up superior, he's kind of stuck superior and can't really bring the head back down. You don't see it so much because this head's not really superior, but he has trouble coming down a little bit. Sorry, I have a little allergies today. So
a definite little arc to the right. There was and when he would turn his head, he was definitely, and I'm going to get my rights and lefts wrong, you'll be able to
I
see
always
the
get,
difference.
no, I can't. I'm bad at right and
like
left.
Ears to one side, nose to the other. He would kind of turn it before he would turn and look.
Let me look at him straight on too.
I'm going to follow you now. Here's friend.
Okay. Come with me.
Okay. What's that thing? Is there food in there? It's a big box. Where's Joey?
When did he get this little patch missing?
He got sick. We've had a couple of nasty tick things go through.
Yeah.
And he got a pretty bad fever from the tick. And he was on an injectable there for a while and then doxy.
I do feel that bilateral atlas. So what you do is you come under and you just flick it a little bit, and then the head can come down easier. So we'll try it. It looks like a lot, but it's not. It's actually just a gentle adjustment. And we talked about this when I first met you. Like, I don't do any of this crazy stuff. I do a lot of just gentle work. This one we just tilt it a little bit because and to tilt it back down so he can reach down, you get on the hind part of it and more on the caudal, the tail end, and lift it a little bit. So I'm going to come under and do that right now if he lets me. Can I get this for you? Can I adjust you? What do you think of that? Trying to bite me a little bit. That was the adjustment. It actually went perfect. I hope it works for him. Hey, this is Dr. Doug Willen. This is my Collagen for Horses product. It's 100% collagen. It's American made. You put a little bit in the horse's food every day and you're gonna see a difference in the coat, in the teeth, the hoofs, the connective tissue, muscle, ligaments. It's good for that older achy horse, but it's also good for a developing horse that's growing into its adult body. Give it a try. So let's let him think about that for a little bit. Take his time. I hope you have 1 carrot left. Why don't you drag him down a little bit, you know. See how low he goes. See if he can come almost. Not too much different. It didn't come down much more, did he? Maybe a little, right? We have more to do. You feel a lot of the withers too?
When it first happened, see, well, right there, he was like,
Yeah.
he was really so. I mean, he spun around and looked at me and went, "Don't." And I was like, "Okay, I won't. I don't touch things I don't know about. I just don't do that." Right?
Okay.
Right there. Yeah. You want to do that?
So-
Waverly's extremely interactive. You ask him, like, when your hands are on him, he'll be pretty clear. If he does the mouth thing, it's a full thing.
Yeah.
It's like, "Don't eat me." I'll go, "Don't eat me." He's not really biting. He's going, "Don't eat me."
So for people watching, I haven't introduced Christine yet. So this is Christine, and she's the owner and founder of Amaryllis Rescue Farm, or Equine. What's the full name?
Amaryllis Farm Equine Rescue.
Amaryllis Farm Equine Rescue, and you've had it since 2005?
Since 1989, actually.
Oh, wow.
We became a 501(c) in 2005.
Okay.
So we're older than the hills.
And you work with your daughter Rachel, and you have 5 properties that you circulate through too, right?
Yeah, we've had horses ever. I was
Yeah.
born here, so
Yeah.
anybody that had horses in the backyard, I have a couple old horses standing there and taken care of.
So I'm going to rub this a little bit, just like a massage.
Boy.
Okay. And I'm just going to hold on the pole here.
You're a good boy.
Very soft.
You're a good boy.
Just that grape pressure, right?
Boy.
Okay, I'm just going to hold this if you let me. Okay.
You're a good boy.
There you go.
Will you eat me?
There you go. He's so cute. Let's come down a little bit. There you go. A little more. A little more. You feel that release a little bit? A little more. Okay, a little more. All right. All right. And then we're going to work our way down to the withers too, because there was that spot that made him lurch a little bit, right?
Yeah.
Okay. Feel this spot here, Christine. So all through here gets super tight, right in there.
Yeah.
Like even right here, this one little
Yeah, he doesn't like
that spot.
Okay. Waverly's very stoic. I have some,
Yeah.
thoroughbreds that they get a paper cut and throw themselves on the ground. Waverly's very stoic. He's I would just bear with what is wrong and not say anything. These kind of horses, you have to watch very closely when they're in your care. These things will get missed.
Because he doesn't complain. He doesn't complain too much.
Does not complain.
I wonder if he's got something under here. So I'm gonna, here you can look a little bit on this side. I'm gonna laterally flex and reach under here. Do you see where I'm going? Under there? Yeah, this gets tight in here. Okay. So this whole line here, feel this whole kind of fascial line, it's all tight through here. Here, you can reach your hand in here. So it's this whole line here, this down here. But especially if I bring his head towards you, so it makes a crease.
So the crease itself?
Yeah, or try to go under the crease. Like you curl your fingers under, and like,
Yeah, he doesn't like that.
and right in there, it's here, right. That's the bad spot right there. To get my thumb under there.
Boy, you're okay. Come on in, don't eat me. You're okay.
That's a bad spot.
Boy, Waverly.
There we go. Now I'm under. I'm gonna just hold that for a minute.
Good boy, Waverly. Boy, Waverly.
Under there. Now he'll step in a second. There you go.
Boy. That's very good. That's very good. Yes. That's very good. Boy. Isn't he cute?
He's so cute.
This is why I was like, I'm calling Doug.
Yay! I'm glad you called me. Okay. Do you want to turn all the way this way? Bring your head all the way this way? Just your head. Let's go this way then. Not bad. Let's check this way now. You don't like this way. So I think I'm going to feel this one right here. So this is the vertebral body right there, like the big chunky part, and it feels stuck right there. So I might do a little adjustment on this one. Here, feel it yourself. So right in here. So these are the big neck bones coming up. I mean, the spinuses all fly up this way, but this is the vertebral body, the big chunk of it. So I want to come in here and adjust this one if I can. I think it'll give him better range of motion coming back to the left. So I just do this and I laterally flex a little because he doesn't like coming this way at all. And then I just, once I feel it, I just do a little adjustment with the back of my knuckle. Here it goes. There you go.
Give a bump on that.
So now I'm going to keep massaging that original spot we were talking about. It's moving a little better. Now, do you want to bring your head this way? Do you have a carrot on you? Can't use the very last one. Oh, still doesn't love coming this way. All right. So right in here bounces again, which is nice. It's got joint spring. Let's walk him around once. Let's see what he looks like.
See, he's holding his neck really braced.
Really what?
Really braced. That's not his normal walk.
He normally carries his head a little more proud.
It would look freer.
Yeah.
His nose. He's Tennessee Walker. They've got kind of a big movement. And see, he's got a real still. Well, now, you know, mind you, a certain amount of time has passed, so I'm sure he's stiff from holding. He hasn't laid down. He wasn't able to lay down for a week and sleep, so I'm sure like just holding muscles are stiff also. Okay. Yeah, so I feel like his nose will come, but his ears won't come.
Can I have this leg? Thanks, baby.
WAVERLY, good boy. Good boy. Good boy.
Can I take this leg out, baby?
Good boy. There you go. There you go.
One more. Okay.
Good boy. Like that. There's a soft eye. Here's his soft eye. That's a good boy. Ooh, he likes that. Ooh, he really likes that. There's his bright eyes. Right.
Come forward a little bit. Come, walk up. Up. There you go. One more round. There you go.
He likes that. His bottom lip is.
Okay. I think that's all. I think that's all we're gonna do on him. I really wanted to just loosen all that up, you know.
He was. You'll see his expressions there. Absolutely what he needed.
Thanks, buddy.
Good boy.
Okay. Thanks for letting me hang out with you today.
Where you going? This is round 1.
You want to do one more?
Yeah, good boy.
But that loosens up the pole and just.
He was immediately like, oh, like you just knew.
Yeah.
You just knew that was there was stuff.
Now everything feels loose from that too.
Good boy. Nothing else. Their eyes never lie.
Yeah.
Like that. There's a bright eye. There's a bright eye, happy face boy. He's a good boy. There he is. There he is. Good boy. That's the best. That's the best.
All right, I think we're done with him. What do you think?
What do you think?
We did enough.
Yeah? Very good.
Okay, are we done?
Ooh, that's a happy face. I haven't seen that face in a while. No, I haven't seen that face in a while. Good boy.
Okay, you did so good.
He's a cool horse.
Yeah.
Very good. You want to go try it out on your own?
Yeah, keep it rolling.
Yeah. Go see how you feel. My sister ate all your
He's so cool.
That's really good. That's really good. See, that's grateful eye. Everyone says, why do you work so hard? That's why.
Right.
Exactly why. Grateful eye. Nothing is better.
Right.
That's very good.
And his top line is relaxed, right?
Very good. Oh, he's completely.
He's in jello now.
He's just He's long and drawn and. I know. Now you got to get back to work because Hotshot is looking at your sister. Babysitting. You want the halter back on? Really?
All right.
You can't have that. We need to go to Joey. Don't worry about Joey. We need to go see Joey. Okay.
Okay. What do you think? Did we have fun today? Can I come see you again?
I'm not putting the halter back on. No more halter.
All right, good work, Christine.
That was good. Thank you.
That's good, right? Will you just follow me around?
Okay.
So that was fun, right? Hi, Joey. Do you want a little work too?
Definitely.
Joey's such a good guy. All right. That was fun, right?
There we go. See, back to work. It's like, oh. That's Waverly. He's able to graze again, and he's very appreciative.
There's a little bump on the front called the anterior tubercle, and it can, hey buddy, and it can tilt down or it can tilt back. And when it tilts back and up,